Good afternoon. This is Dr. Katsanis from the Metabolic Institute in Grapevine, Texas. With me I have one of our patients that is on the program of several days. She has some chronic problems, and she will introduce herself, and then we'll ask her a few questions. Go ahead, please.
Hi, my name is Ala Kutami, and I do have a bouquet of the problem, assorti. I have diagnosed with ulcer, and which is bothering me for quite a long time, and without even know me, I do have that problem. And because of that, I develop a lot digestive problem, couldn't go to the bathroom regularly. I become always tired and constantly chronic fatigue. I also have a lot of inflammation on my neck and sometimes all over my limbs, and it was difficult to function with this kind of problem. Chronic headache, and it's every day. I have at least once a day big headache. Couldn't sleep well because the muscles was kind of scratching on my bone joints. I've been with this program for...
Before you go there, how many years have you been ill?
Good 4 years.
4 years.
I've been so many doctors.
How many doctors have you seen in the past 4 years?
Good 5 doctors.
And what have they done for you?
What have they done? And they give me anti-inflammatory pills, and which is get rid of my inflammation with my necks. And they offer me, I need to do adjustments, and which is, I don't think I have any problem with the bone structure on my neck. They give me pain pills. If I could not handle the pain, then you can have, it's called Darvocet. This is the medication, that's what prescribed me. It's very popular here. And that's pretty much...
Yeah, so for the past 4 years, seeing all these doctors, what recovery would you say have you had from the treatments that they offered you? What kind of a progress did you have?
Well, with all the medicine that had been prescribed before, it is temporary solution, but for some reason you had the plateau, and which does not work anymore. Okay. The symptoms not go away; they're still there.
Okay. Now, how many days have you been in the program here?
And the program I already been
a week now?
11 days.
11 days. And have you noticed any changes at all?
Well, in the beginning, when I starting with the drinking solution, you have right away, this is regenerating like a boost of energy. When you start having IV...
Was that number 1 solution you were drinking?
Number 1, number 2 solution, that's what I start with. Then I went to number 1 solution, and then I start with IV. When I start IV, I feel great, but then you start to feel a little bit tiring, and which is maybe it's normal, but this is what I noticed. Not tiring, sleepy. Mm-hmm. That's the name. The inflammation from my neck is gone. I don't have pain anymore, and I really developed very good kind of sleep. I sleep very, very well, which is the biggest relief for me. For
so sleep is good.
2 years, I couldn't able to sleep.
So
one side.
How many days have you been sleeping this good?
Good 5 days already.
So 5 days, so 4 or 5 days into the program, your swelling went away completely.
Completely, it's gone.
And then you're sleeping just fine.
Just fine.
How's your energy?
Energy level, it's good energy level. However, around 2-3 o'clock, you become sleepy. Not tired, sleepy.
Okay.
Like you need to really close your eyes.
How about your ulcers? Are they still hurting you? Any improvement there?
I do not have any more. It's heartburns and no acid burps. I used to have a lot of acid burps with a rotten smell. This is gone.
How many days?
I do not have disease for already good 4 or 5 days.
So 4 or 5 days ago, the burping went away, the pain in the stomach went away, the sleep is better,
and swelling
is gone, and then you just feel a little bit sleepy in the afternoon. So compared to other programs that you had experienced so far, how would you rate this program?
However, it's easy to go through and easy to follow up, and you did not forget stuff. It's helped me. I'm very satisfied with it. I don't know how long and long run it's gonna help me, but it's helped me right now.
Okay, and how's your memory? You had problems with your memory before?
I never have a problem with the memory, but I do have used to have a disorientation, like you become kind of foggy and somewhere there, like it's called daydreaming. Mm-hmm. I become more alert.
Good.
Because you don't feel that much pain, and when you're in pain, you are become foggy.
Have you noticed any negative effects on the program for the past 10 days?
It's only negative effect. I have some kind of a little bit reaction with when I took the prescription pill to get rid of the parasites.
Well, that's because of the medicine.
The medicine.
She's talking about the biltricide, which causes irritation to the digestive system, nausea, and sometimes vomiting. That happens to almost 100% of the patients.
Yeah, kind of was dizzy and
and dizziness.
And totally gone.
But it's about a day. It lasts for about a day because
day and a half. Yeah, that's about.
Well, that's not the K effect. It's the medicine that causes. But that's part of the. Did you see any parasites in the toilet?
Oh yes, I did.
Okay.
Do you want me to describe it?
Yes.
Well, it's one of the parasites. It's look like the white bubbles. It's like they come all together. This is the one thing I know. It's very abnormal what come out from me. And another one was quite long, kind of gray color with the bloody string inside.
Right. Well,
I don't know what about it there.
If I recall, you had a stool analysis done a couple of years ago. Or did you do stool analysis? Or no?
I do not remember.
Okay.
But
I thought
did
you did.
So many.
I thought you did, and we didn't see the parasites in the stool analysis. So here we see it.
And I also want to mention my husband, and which is he haven't done much of the treatment what I've done, but when he started to take his solution number 2 and solution number 1, he have a problem with dyslexia, and he have some nerve receptors would not make him see double. His eyes become much better. He does not have any more pressure, like he always needs to concentrate and when
so his dyslexia is gone. Almost.
Pretty much, almost, because he does not have any more pressure, and he does not to concentrate, and this is the huge release from his brain, because it's kind of it is released.
What I need to do is have him come here for an interview.
Okay, I will bring him here.
Okay.
And his energy level, he's zooming, he say unbelievable.
Good. Well, thank you for the interview. And
You're
thank you
welcome.
for your time.